Are you tired of constantly running to the bathroom due to an overactive bladder? If so, Vesicare tablet might be the solution you've been searching for. In this video, we will explore strategies for effectively managing overactive bladder symptoms and how Vesicare tablet can play a role in providing relief. Living with overactive bladder symptoms can be frustrating and disruptive to your daily life. The constant urge to urinate, frequent trips to the restroom, and occasional accidents can take a toll on your physical and emotional well-being. But there's hope. With Vesicare tablet, you can regain control and confidence in managing your overactive bladder. Vesicare tablet is a prescription medication specifically designed to calm the bladder muscle, reducing the frequency of urge incontinence episodes and urinary urgency. It works by blocking the signals that cause the bladder muscles to contract uncontrollably, providing significant relief from overactive bladder symptoms. And with a range of dosages available, Vesicare tablet can be tailored to meet your specific needs. Say goodbye to the constant disruption and inconvenience caused by overactive bladder. Join us as we discover effective strategies for managing overactive bladder symptoms and how Vesicare tablet can empower you to live life on your own terms. Understanding overactive bladder (OAB) symptoms. Overactive bladder (OAB) is a medical condition characterized by an uncontrollable urge to urinate, often accompanied by frequency and urgency. It affects millions of people worldwide, causing significant discomfort and disruption to daily life. The symptoms can vary from mild to severe, with some individuals experiencing occasional leaks or accidents. The main symptoms of OAB include urinary urgency, which is the sudden and compelling need to urinate, even if the bladder is not full. This feeling can be difficult to ignore and may lead to frequent trips to the bathroom. In some cases, individuals may experience urge incontinence, which is the involuntary loss of urine due to an overwhelming urge to urinate. OAB can have a significant impact on a person's quality of life, leading to social embarrassment, anxiety, and even isolation. It can interfere with work, social activities, and sleep patterns. If you are experiencing any of these symptoms, it is essential to seek medical advice to determine the underlying cause and explore suitable treatment options. How Vesicare tablets work. Vesicare tablets belong to a class of medications called anticholinergics. They work by blocking the signals that cause the bladder muscles to contract uncontrollably, reducing the frequency and intensity of overactive bladder symptoms. Vesicare tablets contain the active ingredient solifenacin succinate, which targets specific receptors in the bladder, helping to calm the muscle and restore bladder control. When taken as prescribed, Vesicare tablets can effectively reduce urinary frequency and urgency, allowing individuals to regain control over their bladder. The medication is available in different dosages, allowing healthcare professionals to tailor the treatment to each person's specific needs. It is important to follow the dosage instructions provided by your healthcare provider to ensure optimal results. Vesicare tablets are typically taken once daily, with or without food. It is essential to take the medication at the same time each day to maintain consistent levels in the body. The tablets should be swallowed whole with a glass of water and should not be crushed or chewed. If you have any questions about how to take Vesicare tablets, consult your healthcare provider or pharmacist for guidance. Benefits and potential side effects of Vesicare tablets. Vesicare tablets have been proven to provide significant relief from overactive bladder symptoms, offering numerous benefits to those suffering from this condition. The medication can reduce urinary urgency, frequency, and urge incontinence episodes, allowing individuals to regain control over their bladder and improve their quality of life. One of the primary advantages of Vesicare tablets is their ability to effectively calm the bladder muscle, reducing the need for frequent trips to the bathroom and decreasing the risk of accidents. This can be particularly beneficial for individuals who have experienced social embarrassment or have had their daily activities disrupted by the constant urge to urinate. While Vesicare tablets offer significant benefits, it is important to be aware of potential side effects. Like any medication, Vesicare tablets can cause adverse reactions in some individuals. The most common side effects reported include dry mouth, constipation, blurred vision, and difficulty urinating. These side effects are typically mild and transient, but if they persist or become bothersome, it is important to consult your healthcare provider. It is worth noting that some individuals may experience more severe side effects, such as allergic reactions or changes in heart rate. If you develop any unusual symptoms or have concerns about the side effects of Vesicare tablets, seek immediate medical attention. Strategies for managing OAB symptoms with Vesicare tablets. In addition to taking Vesicare tablets as prescribed, There are several strategies that can help effectively manage overactive bladder symptoms. These strategies can complement the medication's effects and further improve your quality of life. Here are some tips to consider. Fluid management. Monitoring your fluid intake can help regulate urinary frequency. While it is important to stay hydrated, excessive fluid intake can exacerbate overactive bladder symptoms. Limiting caffeine and alcohol consumption can also help reduce bladder irritation. Bladder training. Bladder training involves gradually increasing the time between bathroom visits to help increase bladder capacity and reduce urgency. Start by scheduling bathroom breaks at regular intervals and gradually lengthen the time between visits. This technique can help retrain your bladder and regain control over the urge to urinate. Pelvic floor exercises. Strengthening the pelvic floor muscles can provide additional support to the bladder and help improve bladder control. Kegel exercises, which involve contracting and relaxing the pelvic floor muscles, can be beneficial in managing overactive bladder symptoms. Consult a healthcare professional for guidance on performing these exercises correctly. By incorporating these strategies into your daily routine, you can enhance the effectiveness of Vesicare tablets and further improve your overactive bladder symptoms. It is important to remember that everyone's experience with overactive bladder is unique, so it may take time to find the right combination of strategies that work best for you. Lifestyle changes to complement Vesicare tablet usage. Managing overactive bladder symptoms involves more than just medication. Lifestyle changes can play a significant role in improving bladder control and reducing the impact of OAB on your daily life. Here are some lifestyle modifications that can complement the use of Vesicare tablets. Dietary adjustments. Certain foods and beverages can irritate the bladder and worsen overactive bladder symptoms. It can be helpful to identify and avoid triggers such as spicy foods, citrus fruits, carbonated drinks, and artificial sweeteners. Maintaining a healthy, well-balanced diet can also support overall bladder health. Weight management. Excess weight can put additional pressure on the bladder and worsen overactive bladder symptoms. Maintaining a healthy weight through regular exercise and a balanced diet can help reduce the burden on the bladder and improve bladder control. Smoking cessation. Smoking can irritate the bladder and contribute to overactive bladder symptoms. Quitting smoking can have numerous health benefits, including improved bladder control. If you need assistance with smoking cessation, consult your healthcare provider for support and resources. Stress management. Stress and anxiety can exacerbate overactive bladder symptoms. Engaging in stress-reducing activities such as meditation, yoga, or deep breathing exercises can help relax the body and mind, potentially reducing the frequency and intensity of OAB symptoms. By making these lifestyle changes in conjunction with taking Vesicare tablets, you can optimize your efforts in managing overactive bladder symptoms. It is important to remember that lifestyle modifications may not provide immediate results and may require ongoing commitment and patience. Tips for taking Vesicare tablets effectively. To ensure the effectiveness of Vesicare tablets, it is important to follow the prescribed dosage and adhere to the recommended guidelines. Here are some tips to help you take Vesicare tablets effectively. Follow the prescribed dosage. Take Vesicare tablets exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dosage unless instructed to do so. Take Vesicare tablets at the same time each day. Consistency is key when taking Vesicare tablets. Establish a daily routine and take the medication at the same time to maintain consistent levels in your body. Do not crush or chew the tablets. Vesicare tablets should be swallowed whole with a glass of water. Do not crush, chew, or break the tablets, as this may affect their effectiveness. Keep track of your symptoms. Monitor your symptoms and keep a record of any changes or improvements you notice while taking Vesicare tablets. This can help you and your healthcare provider assess the effectiveness of the medication and make any necessary adjustments. Communicate with your healthcare provider. If you have any concerns or questions about Vesicare tablets, do not hesitate to reach out to your healthcare provider. They can provide guidance, address any side effects or concerns, and make any necessary adjustments to your treatment plan. By following these tips, you can ensure that you are taking Vesicare tablets effectively and maximizing their potential benefits in managing your overactive bladder symptoms. Frequently asked questions about Vesicare tablets. Are Vesicare tablets suitable for everyone with overactive bladder symptoms? Vesicare tablets are a prescription medication and should only be taken under the guidance of a healthcare professional. They may not be suitable for everyone, depending on individual health conditions and other medications being taken. It is important to consult with your healthcare provider to determine if Vesicare tablets are appropriate for you. How long does it take for Vesicare tablets to start working? The onset of action of Vesicare tablets can vary from person to person. Some individuals may experience relief from overactive bladder symptoms within a few days of starting the medication, while others may take several weeks to notice significant improvement. It is important to be patient and consistent with the medication to allow it time to take effect. Can Vesicare tablets be taken with other medications? It is essential to inform your healthcare provider about all the medications you are currently taking, including over-the-counter drugs and supplements. Vesicare tablets can interact with certain medications, such as antifungal medications, antibiotics, and medications for other bladder conditions. Your healthcare provider will be able to assess any potential interactions and adjust your treatment plan accordingly. Are there any long-term side effects of taking Vesicare tablets? Long-term side effects of Vesicare tablets are rare but can occur. Regular follow-up appointments with your healthcare provider can help monitor your progress and detect any potential issues. If you have any concerns about the long-term use of Vesicare tablets, discuss them with your healthcare provider. Can Vesicare tablets cure overactive bladder? Vesicare tablets provide symptomatic relief and help manage overactive bladder symptoms, but they do not cure the underlying condition. It is important to continue taking the medication as prescribed and follow the recommended strategies to effectively manage OAB symptoms. Alternative treatments for OAB symptoms. While Vesicare tablets have proven to be effective in managing overactive bladder symptoms, there are alternative treatments that can be explored if Vesicare tablets are not suitable or do not provide sufficient relief. Some alternatives include behavioral therapies. Behavioral therapies such as bladder training, pelvic floor exercises, and biofeedback can help improve bladder control and reduce overactive bladder symptoms. These therapies focus on retraining the bladder and strengthening the pelvic floor muscles to enhance bladder function. Nerve stimulation. Nerve stimulation techniques, such as sacral neuromodulation or percutaneous tibial nerve stimulation, PTNS, can help regulate bladder function and reduce overactive bladder symptoms. These procedures involve the use of electrical impulses to stimulate specific nerves involved in bladder control. Botox injections. In some cases, Botox injections into the bladder muscle can help relax the muscle and reduce overactive bladder symptoms. This treatment is typically reserved for individuals who have not responded to other therapies. Surgical interventions. In severe cases of overactive bladder, surgical interventions may be necessary. These can include procedures to increase bladder capacity or divert urine flow, depending on the underlying cause of the OAB symptoms. It is important to consult with a healthcare professional to determine the most appropriate alternative treatment options based on your specific needs and medical history. Conclusion: finding relief with Vesicare tablets. Overactive bladder symptoms can be disruptive and frustrating, but with the right strategies and medication, you can effectively manage and reduce their impact on your daily life. Vesicare tablets have been proven to provide significant relief from overactive bladder symptoms, allowing individuals to regain control and improve their quality of life. By understanding the symptoms of overactive bladder, how Vesicare tablets work, and incorporating lifestyle modifications and strategies for managing symptoms, you can enhance the effectiveness of Vesicare tablets and optimize your overall bladder control. Remember to consult with your healthcare provider for personalized advice and guidance on managing your overactive bladder symptoms. They can help assess your specific needs, prescribe the appropriate dosage of Vesicare tablets, and explore alternative treatment options if necessary. Say goodbye to the constant disruptions and inconveniences caused by overactive bladder. Take control of your symptoms with Vesicare tablets and live life on your own terms.